Good morning, friends, once again. Well, we are going to talk about pressures, blood pressure, of course. What is blood pressure? The lateral pressure exerted by blood on the vessel wall while flowing through it. So, in other words, blood pressure is the measurement of force applied to the arterial walls. So, what is the value of this normal blood pressure? Well, we are not talking about the guidelines at the moment. We are talking about the normal blood pressure. We are not talking about hypertension, to be precise. Well, normal blood pressure is 120 stroke 80 millimeters of mercury, which is important for tissue perfusion. Whenever there is a fall in blood pressure, the blood flow to the vital organs also falls down. That's very crucial. So, the vital organs immediately get the blood flow restored by various mechanisms. What are these mechanisms which we need to know? Well, the first and the most important is the sympathetic nervous system stimulation. Second, you have the baroreceptor mechanism. And the third, which we are going to discuss today, is the renin-angiotensin-aldosterone system. Well, as we know about this system, a number of times we have heard this. Whenever we talk about the various antihypertensive drugs, we talk about the renin-angiotensin-aldosterone system, the RAS pathway. Well, angiotensinogen, as you all know, it is a zymogen. It is a prohormone or a protein which is produced by the liver cells or the hepatocytes. And this enzyme, the proenzyme, gets converted to angiotensin 1 in presence of renal renin and tissue renin. Now, angiotensin 1 again is an inactive form of the enzyme, and in presence of lung ACE, that is angiotensin converting enzyme, and in presence of tissue ACE, that's a tissue angiotensin converting enzyme, cathepsin and chymase, angiotensin 1 gets converted to angiotensin 2. Now this angiotensin 2 acts on AT1 receptors and AT2 receptors. On stimulation of AT1 receptors, that is angiotensin 1 receptors, there is increase in sodium reabsorption, there is vasoconstriction, and there is increase of aldosterone secretion. When all these cumulatively increase the blood pressure. Now, supposedly, if a person is having high blood pressures, we need to reduce the blood pressures. So this angiotensin 2 stimulates the AT2 receptors, increases bradykinin synthesis, causes vasodilation, and increases the synthesis of nitric oxide. All this cumulatively will reduce the blood pressures. Henceforth, whenever there is an increase or a decrease, your renal renin plays an important role in regulation of the blood pressures. Now, what are the factors which affect the blood pressure? So, there are certain factors which are responsible for the cardiac output, and there are certain factors which are responsible for the peripheral resistance. Now, all these account for a blood pressure control. So, my dear friends, the equation. So, my dear friend, once again, this is not a mathematical calculation or a formula. This is not a mathematical formula to calculate blood pressure. It is merely an equation which represents the various parameters which are responsible for affecting the blood pressure. So when we consider cardiac output as a parameter, which regulates blood pressure, we have four factors which, on the contrary, control the cardiac output. First, force of contraction of the heart. Second, the volume of blood flowing in the body. Third, your heart rate. And fourth, the venous return. So once again, do a recap. The cardiac output is affected by four factors. Which are they? The first one, force of contraction, blood volume, heart rate, and the fourth, venous return. So what are the factors which control your peripheral resistance? The factors which control peripheral resistance are lumen of the vessel, elasticity of the vessel, velocity of blood, viscosity of blood. And when we talk about blood pressure, then it is all these 8 factors which come into play and affect the control of blood pressure. So for example, when the force of contraction increases, of course the cardiac output will increase, and so would your blood pressure. Once your heart rate increases, your cardiac output will increase, so would your blood pressure. If the blood is thick and viscous, the resistance offered will be high, so will your blood pressure. So all these parameters, they work on direct proportion. So which is the factor which is inversely proportional? Is it any one of them? Can you point out? Okay, now I'll tell you. Suppose if your heart rate is low, what will happen? Normal heart rate is 72. If it's around 40, what would that mean? Well, that means that you have got bradycardia, you will have less cardiac output, and so will you be in a state of a shock with your blood pressure going below 100 by 60 millimeters of mercury. So all these parameters work on direct proportions. Whenever there is a rise in the elasticity of the vessels, which mean the vessels can accommodate more blood, there will be a fall in the blood pressure. Whenever there is a constriction of the vessels, there will be an increase in the peripheral resistance, and there will be rise in your blood pressure. So all these factors control blood pressure and simultaneously control the hypertension as a disease. So certain other parameters which are of utmost importance. First is the cardiac output. Now this is an equation. This is a mathematical equation which will give you the values of the cardiac output. So it will be a formula, a mathematical formula to be precise. So cardiac output is equal to SV into HR. Well, if you elaborate it, cardiac output is equal to stroke volume into heart rate. We are aware that normal heart rate is 72 beats per minute. Now what is the value of normal stroke volume? Well, in normal, the stroke volume measures 70 ml, that is 70 milliliters. So cardiac output in normal will be equivalent to approximately 4900 ml, which is equivalent to 4.9 liters. That is the amount of blood which is present in your body. So cardiac output is equal to stroke volume into heart rate. How do you calculate the stroke volume? Well, stroke volume is equal to EDV minus ESV. You subtract the end diastolic volume from the end systolic volume. So in normal conditions, the end diastolic volume is 120 ml and end systolic volume is equivalent to 50 ml. So the normal systolic volume, the stroke volume, will be equivalent to subtracting 120 from 50, which is equivalent to 70 ml. Now, when we talk about the stroke volume, the cardiac output, we should know what is ejection fraction. Well, ejection fraction is a ratio of systolic volume to the end diastolic volume multiplied by 100, which is equivalent to 70 divided by 120, which is equals 58%. So these three parameters are something which we have learned new. Let us do again a recap of them. Right, we'll go from the first equation which we saw. Blood pressure is equivalent to cardiac output into peripheral resistance, where cardiac output depends on four factors. What are these four factors? Force of contraction, blood volume, heart rate, and venous return. Peripheral resistance is dependent again on four parameters. What are these factors or parameters? Elasticity of vessel, the lumen of vessel, the velocity of blood flow, and the viscosity of blood. What is cardiac output? Now this is a mathematical formula. Cardiac output equals stroke volume multiplied by heart rate. Stroke volume equals end diastolic volume minus end systolic volume, and this equals approximately 70 milliliters. What is ejection fraction equal to? A ratio of stroke volume to end diastolic volume multiplied by 100 equals 58%.